oxygen.
In the heart. Does anybody wants to?
No.
I'm here. I'm recording.
Of course, I know. Can you stop recording? Yeah. If you like to go through the heart, I'll go through the heart. If anybody wants to see these structures here, like the heart, you should know the 4 chambers: right atrium, auricle of left atrium, left ventricle, right ventricle, and the division between left ventricle and right ventricle is the interventricular
Sulcus.
Interventricular sulcus. There are artery. It's called interventricular artery, and the great cardiac vein. They run in the sulcus anteriorly. Posteriorly, we call it posterior interventricular sulcus, and the artery having the same name, posterior interventricular artery. The vein here is called the middle cardiac vein. So middle cardiac vein with the great cardiac vein. This is the great cardiac vein that comes from here. Great cardiac vein, plus other veins, like the lateral cardiac vein, they join and make the cardiac sinus. So this is the cardiac sinus. And then, it's called coronary sinus. Coronary sinus, okay? Now, the coronary sulcus is this sulcus, which is between the 2 atria and the 2 ventricles. So this coronary sulcus goes all around,
and it's dividing the atrium and the ventricle.
And the 2 ventricles.
Okay. It divides them, right?
Yeah.
The atrium and the ventricles.
What runs in the coronary sulcus?
Excuse me?
What vessels run in the coronary sulcus?
The pulmonary artery.
No. Pulmonary artery is here. This is pulmonary artery. This is pulmonary artery.
No,
the coronary arteries. The coronary arteries, right and left coronary arteries, are the ones in the coronary sulcus. So, left starts from the aorta. That's the left. From the behind, you can see it. This is the left coronary artery.
Okay.
Left coronary artery. It gives this branch, which is the anterior descending branch or anterior interventricular artery. Or it will continue as circumflex artery. So that's the circumflex artery on the left. On the right side, this is the right coronary artery. It gives the right marginal artery and continues to give the posterior interventricular artery. That's from the right. So both right and left coronary arteries, they run in the coronary sulcus. Now about the large vessels, superior vena cava, that's inferior vena cava. And about the arteries, pulmonary trunk, that divides into left pulmonary artery and the right pulmonary artery. The right is here. And this is the aorta. And when you open to see the chambers from the inside, you can see the valves, so you should know all the valves. You should know that this is called pulmonary valve, which is semilunar, and the aortic valve is semilunar also. You can see the tricuspid valve, the mitral valve is here, mitral, and tricuspid is here. So these 2 AV valves, you can see their leaflets, you can see the chordia tendineae on both sides, attached to the flaps of the AV valves. You can see papillary muscles, like number 4 in Latin is papillary muscle. And you have ridges. The ridges, like these ridges, can you see the ridges? Or here? These ridges are called trabeculae carneae in the ventricles.
What was that again?
The ridges.
Okay, I remember it on the paper.
Can you see the ridges here in the ventricular wall? This is what you call trabeculae carneae. In the atrial wall, the ridges are called pectinate muscles. So these are pectinate muscles, trabeculae carneae, and these muscles are the papillary muscles that are attached to the chordia tendineae.
I don't think that's on the paper that we need to.
It is. Oh, okay. Yes, it is. Now, you see this is the interventricular septum, and you can see the myocardium on the left side is thicker than that on the right. And you can, what else you can see? You can see here this opening, and this opening. What for are these openings? Can you see the red spots? These are the veins that enter the left atrium. This is the left atrium, so these are pulmonary veins. 2 from the right, 2 from the left, and 2 from the right. Okay? And they open here. All of them, they open
So that's
here.
the opening for the pulmonary veins.
Pulmonary veins. Now on the right side, can you see this red spot? What is it? No, it's coronary sinus. This is coronary sinus.
Is it the
here.
AV valves?
Coronary sinus.
This is the coronary sinus. This
So the
vein,
opening
this
for
vein
pulmonary.
opens here in the right atrium, right? You have this is the opening of which vein? What opening?
Superior.
Yes, superior vena cava.
Superior.
And the inferior vena cava is opened already.
Right, interior.
And so the little one that you
And this one here is
is
the fossa ovalis.
fossa
Fossa
ovalis.
This area is the fossa ovalis.
That's all right.
Oh, possible.
Okay. In other hearts, it has different color, but that's fossa ovalis, which is in the interatrial septum. Forgot to tell you, this ligament here, which is between the two arteries, the two large arteries, this ligament, what do you call it?
The ligament.
Ligamentum
Atrial.
arteriosum. Yeah, ligamentum arteriosum. Yeah, that's right. That's called, it was ductus arteriosus after closure. It's a ligamentum arteriosum. So you should know the ligamentum arteriosum and should know the fossa ovalis in each heart.
Okay.
If there are other heart models, I
was
can
about to
show you
say-
these two structures because
If there's